We are so glad that you all have joined us today for this incredibly important conversation. My name is Jen Esterline. I am the Senior Vice President of Child and Family Strategy for the Meadows Mental Health Policy Institute, and I'm going to be your moderator today. So welcome. Thanks for being here. I see people are joining, so we'll go ahead and slowly ease in as people join up. So first of all, I just want to give a huge thanks to Grantmakers for Education. I am a bit of a fangirl of GFE. I have been a member for many years. For about a decade, I was executive director of a small family foundation based here in Austin, Texas. And I always like to tell the story that GFE was literally the very first conference that I went to within just a few days of being a brand new, at the time, program officer. And I am totally serious. And I'm not just saying this because we got invited to speak to this today. I really mean it. I really attributed that first GFE conference to helping build so much of the foundation in which I was able to build my professional career. The content is amazing. The people are amazing. The staff, the members, the networking. It was just such an incredible experience for me, that very first conference. And I went to many after that. So I really want to encourage you, if you're not a member, consider joining. It is well worth the return on investment. It's really, really awesome. So thanks to GFE for having us today. And I'm about to turn it over to our panel here in a second, but I was hoping before I did that, I could just say a few words to kind of set the stage for what we're going to be talking about today. So just a very quick thing about the Meadows Mental Health Policy Institute. We're a nonprofit, nonpartisan organization based in Texas. We do a lot of work on the ground in communities across the state and increasingly nationally. And we have known that we have a growing mental health crisis for our young people for quite some time. And because of that, we have been doing a lot of work in multiple systems where children, youth, and families, young adults, and adults find opportunities to come in contact with mental health care or have the opportunity to come in contact with mental health care. So we work in health systems. We work in education systems, both K-12 and higher education. We work in justice systems, really any system where a person comes in contact with mental health care or could come in contact. And we really are working at that systems level. So making sure that what's happening on the ground in communities across Texas and across the nation, that we're able to translate that up to a statewide and increasingly national conversation. Policy, which is in our name, being one of those levers that we really like to pull to think about how we move the needle in mental health care. So our vision and mission at the Meadows Institute is for Texas to be the national leader in treating all people with mental health needs. And really, our work in post-secondary mental health came to really be not, we were doing some work in post-secondary mental health, but it really kind of blew up around the time of COVID. And I want to underscore that because we knew, I think everybody here on the call and all of the institutions of higher education across the state and the nation knew that when COVID hit, that focus on basic needs as a way to keep students in school, enrolled in college and working towards their post-secondary credential, all of a sudden overnight, that became super, super apparent that basic needs were a critical factor in post-secondary success. And I think at that time, we also realized, when I would speak to community college presidents in particular, the chancellors I spoke with in 2020 were more concerned about the mental health needs of their students than they were even concerned about the academic pursuits. And so I think all around 2020, 2021, it just became increasingly clear that mental health is a basic need, right? We know that mental health is a basic need. And we know that personal mental health and emotional stress are two of the leading factors that students cite when they're talking about why they choose to either stay enrolled or stop out or drop out. And it's also a huge indicator of whether or not they're going to enroll in the first place. So we know what a critical role it plays. And I think we understand too that our university leaders, our higher education leaders, really understand what a critical need it is. I think at the Meadows Institute, what we've realized is that even though the leaders, institutional leaders often know it's a critical thing, that it really is a basic need that we have to address at an institutional level, there's sometimes a lack of understanding about what the best way to do that is, right? And so the two of the things that we're really going to focus on today in our conversation are sort of what are those best practices. We talk a lot at the Meadows Institute about evidence-based practices, but even if they're not evidence-based in the traditional definition, best practices, promising practices, practices that we know work for students and staff is something we think about a lot. So we're going to talk about that today in our conversation. We're also going to talk about, because I think this is where a lot of leadership struggles, is how do you scale that? So we know in Texas, y'all know everything is bigger in Texas. Everything we do in Texas is at scale. We don't have a choice. And Jenny, you correct me if I'm wrong, but I was asking some of my team members, how many students are we supporting in Texas when it comes to higher education, right? How many students are being served in institutions across the state? And I read 1.5 million. So check me if I'm wrong or right on that, but it's a lot. It's a lot, y'all. So everything we do is at scale. And the conversation that we're going to have today with these incredible panelists is going to be talking about just that. Before I introduce everybody, I want to just give a special shout out to Jenny and the team at the Trellis Foundation. So the Trellis Foundation, and the reason this is such a cool conversation today, getting to speak with grant makers, is the Trellis Foundation is a statewide philanthropic leader in Texas focused on post-secondary. And they really stepped out in a huge way on mental health and well-being. And you'll hear the story. Jenny's going to tell the story. But I really just want to give them a huge congratulations because because they are statewide leaders, they have really made a mark. They have really put, the flag in the ground on this issue, and it has created this incredible groundswell of interest and work happening, some of which you're going to hear about today. So I just want to give Jenny and the team at Trellis an extra special shout out for them really taking a chance and stepping out in this space. Okay, so with that, I'm going to introduce our esteemed panel. We have Jenny Achille. She's the Senior Director and Chief Program Officer at the Trellis Foundation. We have Dr. Leticia Duncan Brosnan from Alamo Colleges. She's the District-wide Director of Student Advocacy Network. And my colleague, Leilani Lamb, who is the Director of Cross Systems Policy and Practice at the Meadows Institute. So with that, I think we can go ahead and take down the slides, and we're just going to have a nice chat. We want this to be informal and fun as it can be over Zoom, even though we all would prefer to be together. We are going to spend the last 15 minutes or so in Q&A. So please, please, please feel free to add your questions to the chat, and we'll try to get to as many of those as possible towards the end. And I think with that, I'm going to ask Jenny our first question. I'm going to ask her to kick us off. So Jenny, can you tell us, how did this all begin? How did this come to be?
Absolutely. Thank you, Jen. And I want to also say thank you to GFE for hosting this conversation today. And also wanted to thank you all for joining us. I'll give a shout out to the Postsecondary Access and Attainment group, the impact group at GFE. And I am so excited to help represent that group as part of the triad with Robin Ellis, who is joining us. Actually, she's in attendance. You just can't see her. And then Jonathan Reed. So we are excited to serve you and excited for this series. And Robin has really spearheaded this along with the committee as part of that impact group that is bringing this to you today. So again, thank you all for taking your time today to join us. We're really excited to be here, and I'm excited to share with all of you. And to be upfront, we know this is a group full of funders for the most part, and so the conversation today is a little bit different from some of the ones we've had in other spaces. And so I just really want to bring that lens for you guys of how we were thinking about it. And please ask questions on anything I leave out. But that's my part today. So I won't get as much into the details about mental health and well-being itself, and I'll be more just focusing on the funder lens. So Jen set things up really well in terms of what the environment was like and what we were also seeing out in the field. In 2020, we actually did our first strategic plan, and as part of that, we came up with our 3 focus areas. at the foundation, and that's holistic student needs, streamlining student pathways, and reconnecting learners. And we intentionally called that first focus area holistic student needs instead of basic needs. So we were thinking a lot about student basic needs, but we wanted to give ourselves a little bit broader nomenclature so that we would have a little more room to respond to things as they came up. And so for us, mental health and well-being goes within that holistic student needs focus area, and we were really glad to keep it broad enough to be able to think about it that way. Although for those of you who may not have that kind of a lens, would absolutely say any lens you do have when you're supporting students, mental health and well-being can fit under that. So encouraged to see so many of you today interested in this, and hope you'll consider it. I also do want to, again, I know Jen called this up for folks, but as a reminder, this is hosted by the post-secondary group, so we will be focusing on post-secondary. A lot of these things can be applicable if you're one of our colleagues who also works in K-12, but today we are going to be using that lens. So in 2020, we knew that mental well-being was going to be a key need to address, but to be honest, the Trellis Foundation had no idea how to do it. So I'm going to talk a little bit in the weeds of grant making practice here today for y'all. We knew there was a need. We weren't sure where to get started. So we started out just with a landscape scan. So internally, we did a lot of research, seeing who was doing work, what was showing up in news articles, what was showing up in research, what were the key players who were coming up, and 3 national organizations rose to the top anytime we were doing searches around post-secondary education and mental health, and that was Active Minds, the Steve Fund, and the Jed Foundation. So we knew from the beginning, we knew we needed a cohort model and that we couldn't do it by ourselves because we didn't know enough. So we stepped out in a way that we haven't really done before. So we knew, okay, those 3 partners have got to be on board because our colleges are going to need technical assistance. But then we were like, okay, but in order to really lead this work, we need someone who has a deep understanding of our regional, and for us, the state landscape, because any kind of health, whether it's physical health, behavioral health, mental health, really is tied to the community that it's in. So as colleges and universities, you're existing within a regional landscape. And so we wanted folks who really understood that. So we were so excited to be able to call up our top partners and now official grant partners for 2 years in the Meadows Mental Health Policy Institute and ask them to lead this work from that backbone for the cohort and bringing in their regional expertise. And so together, we crafted the RFP. So the Trellis Foundation did the initial draft, but before we released anything, we had already brought on Meadows to be able to look at that the request for proposals with us to make sure that we were designing something that could work. And so it was the first time we've ever done that. We'd worked with folks after the fact before, but we had never partnered with somebody from the beginning. And I really highly recommend that as a strategy in general. It's a model we're going to continue to do. And so they partnered with us, and then they helped us look at applications. So together we scored and really had conversations around what makes sense in this cohort. How can what's the best fit for what we're able to provide with the technical assistance that we have? So that was a lot of it, right? It isn't what's the most deserving, it's just what's the best fit for what we can offer. And so they helped us really think hard about that. And as we moved forward with that, a couple of things on the RFP, we did ground it heavily in a frame of basic needs because we do understand, as Jen said, that interplay between if you're lacking in all of your basic needs fulfillment, that exacerbates your mental health. And then also, if you're struggling in mental health, that can also then lead to some other things that affect your basic needs. So there's a really strong interplay, and we wanted to really recognize that. So we framed it in that, brought these 4 partners together, and move forward with the model. And we ended up with 10 colleges or universities around the state, again, really thinking about things regionally. And then I do want to say, for us, again, as from the funder perspective, it was critical. I knew we needed this TA, and I knew all 4 partners. So the 3 national and the local all had key expertise we needed to bring to our grantees. But I had no idea how to do that. So, so shout out. I know Leilani spent many hours really thoughtfully crafting a curriculum and a partnership and taking care of how we would braid the payments for all of those things. So I really want to say that if you're able to find a partner like Meadows who can really help as a thought leader and as a grant crafter with you, that was key for us in the success of this. So just as I stop this part of it, I just want to underscore for us, like we stepped out on a limb. We didn't know what we were doing. We were really nervous. We were as far as we knew, the first post-secondary funder, like really working in this area in Texas anyway, and it wasn't being robustly done around the country. So we knew it was important. We stepped out a little bit on a limb, but we felt comfortable doing that because we were able to find and work together with such great partners. So that made it more comfortable for us. And I think that as we've gone, we've really learned and iterated, and it's really been a fruitful partnership. So just for those of you who are thinking about stepping out in something like this, always happy to talk to you and share more. But I think that the partners that you're working with can really be key if it's an area you're not an expert in. I'm done.
Amazing, Jenny. Thank you for that. Leilani, jump in here. What was it like from our end at the Meadows Institute? Talk a little bit about your role and how you saw this all coming together.
Well, as you can tell from that answer, Jenny is brilliant. And I have known Jenny and Charles Foundation for some time.
Leilani is the brilliant one.
We're going to just argue about this the whole time about who's the most brilliant, but you are incredible. And when Charles Foundation called the Meadows Institute, I was so excited. So I've known Charles Foundation for a while because I have been kind of in and around higher ed throughout my career. And previous to this, I worked really in post-secondary success and attainment, doing things that were moving the needle. We were expanding dual credit pathways, doing work-based learning, really working on those things. But as the commissioner said in the Commissioner of Higher Education in Texas at the Charles Foundation Summit a couple of weeks ago, I was seeing the same thing. The kids are not okay. And as I was doing this work, and as I was hearing these stories that Jen mentioned earlier from chancellors mentioning that what kept them up at night is their students' mental health and well-being more than anything else, I recognized that I needed to move into this space if I really wanted to make a lasting difference, both on students and on their attainment. So I moved over here, but then I was sad because I really liked working with funders like Charles Foundation, who traditionally only did post-secondary success and initiatives around that prior. So when we got that call from them, I was thrilled. And I thought it was so thoughtful how they approached this. Again, I'll talk a little bit about how we did it, but from a funder's lens, like Jenny mentioned. But I really enjoyed how I think the Charles Foundation approached this through a learning lens. It really became a learning lab. And that was the core philosophy throughout all of the communications. So one thing that we've noticed, I think, throughout all of our work in post-secondary is that there is no silver bullet. There is no one right answer. So it would be disingenuous of us to say, all of these institutions, we had 5 2-year and 5 4-year, to come join us and we will tell you how to do something, because we, like Jenny said, it is unique to their context. It's unique to their resources, their students, and their needs. So the goal of this was really learning. And it was a 2-year learning community, which was really fascinating because it was really based in implementation. So that 2-year I thought was clever because that gave the institutions a 1-year on-ramp to do a lot of planning for their programs. And as we did that 1-year on-ramp, I recognized that a lot of times when you're throwing spaghetti at a wall, it's not sticking. And when you have a 9-month or 1 year, you then walk away. So with this 2-year, we were really able to dig into what's not working, adapt over time, and really think about how we're sustaining. And I really enjoyed that. I was doing a recent report, and I'll talk about that a little later, that everyone is sustaining a component of their programming that they started. And then in addition to that, in addition to what they put in their grant proposal, they were able to do a lot of innovations because of the peer-to-peer learning that they did through this. So I thought it was brilliant as a learning lab, and I really like the cohort model because we really were wanting to elevate a lot of these learnings for the wider field. But in order to do that, you need to know what was happening in the field. So we had the privilege of having really close relationships through these implementation calls that we had with each of the grantees to learn what's working, what's not working, where are the challenges bubbling up, and where can we support you. And without their vulnerability, without that focus on learning, and without that openness to really share those challenges and successes and hold space to celebrate each other and uplift each other, I don't think that this would have been as successful as it has been. So I really wanted to thank you, Dr. Duncan Brosnan and Alamo Colleges and all of our partners, because as we were going through those applications, we were so excited to see Alamo Colleges apply because they have a huge cultural and regional breadth and a foundation of institutional commitment that has really made them be able to make huge strides in this. And I knew they would be an amazing partner, and I was right about that.
Amazing. Okay, so Dr. Leticia Duncan Brosnan, your turn. You know, we've heard from the funder, we've heard from the sort of TA provider perspective, facilitator. Let's hear from an institution who, who got to, live this in real time. What compelled you to apply? What were you seeing with your students? You know, why was this of interest to you as you learned about the opportunity?
Well, thank you, Jennifer, and Leilani and Jenny. So as you know, coming through COVID, our teams were identifying students that were seeing an increase in presenting with depression, anxiety, isolation, loneliness, and suicidal, ideation. And as a result, we came together and we formed a college committee with various partners that we call the Alamo Thrive Committee. And as a result of the funding that we received from the Trellis Grant, we were able to deploy surveys across all of our 5 colleges. And the data and the information was so rich. But like anything, what do we do with the data? And again, through Meadows, they facilitated us to work with the JED Foundation. And we had a JED campus advisor who actually assisted us in creating strategic plans for each one of our colleges. And each college in the Alamo College District is very unique. All our schools are HSIs, but St. Philip's is specifically one of the first in the nation to be an HSI and a historically Black college and university. So we needed plans that were unique to each college, but yet we saw similarities and we also identified gaps in our services. And through Meadows and their curriculum, we were able to have training for all our practitioners and our partners. For example, we had our coordinator of disability services and our veteran services also join us in many of the trainings. We involved student life. We involved our peer community students and our foster youth. And so it was an opportunity to take advantage of the learning curriculum that we were able to have access to that, Leilani and Meadows put together. And we had national experts, again, like we mentioned, Steve's Fund, Active Minds, the JED Foundation. We also had relevant best practices and relevant research that we were able to inform all of our practitioners. Something that we also felt that was very important, and I think for grant funders, this is very important, is that you have this project coordinator director like Leilani, who was guiding us and meeting with us regularly. She knew every project that was funded through the grant. And whenever we needed help, because we knew that we needed support and help, sometimes we had questions in our meetings, and she was able to connect us with our colleagues that were also funded by the grants, who had done something, who were initiating, who had the information and the expertise. So from a practitioner, from a college perspective, the funding, but the curriculum and the technical guidance was very, very important to our work.
Thank you, Dr. Duncan Brosnan. That's great. So let's sort of shift now to those learnings. So Dr. Duncan Brosnan talked a little bit about some of those learnings. Leilani, could you sort of expand on what she just shared in terms of what some of the other institutions were learning as they went along in the learning community?
So Dr. Duncan Brosnan could not have set me up even better. It was almost like it was planned, but it really wasn't. So I really believe, and I know the Meadows Institute really believes in the learning community model because we use it across all of our work in higher ed, in K-12, and health systems and more, because there are persistent silos. And this is particularly a problem in post-secondary. We're not only siloed within our institutions, but within our communities. And there is very there are very few opportunities for peer-to-peer learning. So I was really excited about this learning community model because it really fostered that opportunity for peer-to-peer learning. And like Dr. Duncan Brosnan mentioned, I had so much fun playing Tetris, putting all the puzzle pieces together. Whenever someone was launching a graduate intern program for students who are seeking their practitioner license, I was able to connect them with someone who's been doing it for a while, so they didn't have to recreate the wheel every time. Because that is something that we learned working with these institutions, is that they were always recreating the wheel. And when you're doing that, especially when you're doing it with grant-funded projects, you're basically starting over and over and over, and you're not really making any gains. So through that, we really had implementation be the grounding principle in the curriculum that we designed so that we could support all of these institutions in that. And when I say it was the grounding curriculum, it was everything that you need to think about from beginning to end when you're implementing a project, starting with having the right people, policies, and processes in place in the very beginning of the curriculum to the end where we're looking at data and evaluation, sustainability, and serving all of our students equitably. So through that, I recognize that we need flexibility to adapt to things that are happening along the way. And this is something that I really respected in the way that Trellis Foundation approached this grant, is that they gave all of the institutions funding flexibility for when something came up. So for example, I know that UTRGV had a really interesting Alamo Thrive program where they're bringing together everyone across the institution to really be a frontline approaching mental health, or frontline in addressing mental health. That means training people on how to talk about it. That means having like strong referral systems. And that means having everyone from your chancellor's or your president's office to your parking attendants, to your students, to your faculty and your staff trained in this. And as they were doing that, they recognized that there was a lot of student engagement, an unprecedented amount of student engagement and energy around it. So they reached out to Trellis Foundation and said, hey, we have these students who are so engaged, they really want to go to this Active Minds conference, launch this Active Minds chapter, and do a lot of student engagement work. That wasn't originally in our RFP, but is that something we can do? And Trellis Foundation was like, yes, go for it. You have this opportunity, make it happen. And they did. And those students are such amazing stewards of this work. Not only are they coming to all of these events that we're hosting, so there are events with like adults, and they're the most active and telling us their voices, and we really need that student voice in this work. But they are creating a system where they train future students. So they've really embedded this. And I think when you're implementing something, and when you're a funder who's working with institutions implementing something, it is critical to have that funding flexibility, because sometimes things may not go according to plan and you need to amend things, or sometimes an incredible opportunity may arise and you need to seize it. So that's something that we really learned, is just to hold that flexibility.
I love that. I love that focus on trust. I know the term often is trust-based philanthropy, and I think we really felt like in our partnership with the Trellis Foundation, there was that incredible amount of trust so that we could sort of maneuver as we saw fit over a very new topic with a new group of partners over a very long period of time. So that's a great thought. So Jenny, do you want to elaborate on that? I mean, I know we talked a lot about sort of the direct funding of this learning community to your project, but you all are savvy funders and you're thinking about sort of all the tools in the toolkit. Do you want to just mention sort of other things that grant makers can think about as they're engaging in this space?
Yes. And then I may just also jump a little bit more into the weeds too about what we were learning.
That too.
So I know that long term, one of the things we're really thinking about is always systems change and policy change. And so really relying on Meadows to help us take the learnings from this work and think about how we can influence wider systems in that. And to that point too, one of the in the weeds things we learned through the RFP, we've continued to see it, I think, throughout the implementation. And I think it also speaks to some broader policy needs, is how much campuses still also need basic needs support. So while we're talking about this, so because we were flexible and we did in funding, in budget requests, and we did frame it within a basic needs support frame, a lot of the budget line items in this grant were basic needs, right? So folks knew they were going to get TA for the mental health and well-being, but honestly, a lot of applicants I think may not have even known what they would need to ask for in terms of the mental health budget requests at that point. Like and Leilani, correct me if I'm wrong, I think in that RFP, like honestly, none of us knew what we were doing, and not everyone. I'm not speaking for Dr. Duncan Brosnan, but I think that a lot of the folks, when we started out in this process, it's like, we know students need something. You need a budget for me. You mentioned basic needs. I also need basic needs support for my students, which just is hard to sustain with just private dollars. So I also still think that that's an important thing for us to think about, like to the extent to which basic needs affect mental health and all the rest of our lives. There are some broader funding mechanisms than what campuses and what foundations are able to do, and also in terms of mental health and well-being. So I'll say the things, if I can, just a couple other things that I know we've learned and really seen throughout this are, again, that need to think broader, right? Because a grant is it's a very short-term process. And so helping make sure that as you're working with institutions, you're thinking within their long-term strategy and within their way of doing business and doing support to students, so that it can be sustained within the campus's structures afterwards. So doing things that make sense. So I will say that, just to underscore the peer learning among colleges, peer learning among students, I do want to call out that the active mind support, like students can be active partners in the solutions on their campuses too. And that's I think we're all really learning that now, those of us who are in states with legislation that limits some of the ways that professionals can support students, especially when you're talking about diversity, equity, and inclusion. I think that students are stepping up to support each other. And I think that the Active Minds model with mental health was already a really solid way of thinking about students supporting other students. So I'm going to pause there. Jen, is there anything I missed?
That's great. Leilani, you came off mute.
Yes, I got really excited about something Jenny said, and I wanted to add something, because you mentioned the role, like approaching this from a systemic lens. And in this grant, or in this cohort, we were working predominantly with a lot of student services, which really created a grassroots approach. And this got me thinking about the role of partners and funders, because something I found really groundbreaking with this grant. I mentioned earlier that it was a learning lab, and that we are escalating those learnings in the field. So by having that really significant public-facing approach, they really started shaping the conversation on a broader scale. And I think that's kind of the role of partners and funders, because we have these platforms where we can say, we're seeing this on the ground. This is a challenge. This is what's happening. Let's look at this. And I think a lot of that has led to that groundswell of support that we're seeing now as Trails Foundation is closing this 2-year RFP. I just wanted to mention that that was something that I found extremely compelling, and that, at least in my project-based work before, that has not been as big of a component, and I think it was one of the most powerful ones in my experience.
I love that. And Dr. Duncan Brosnan, I know that this wasn't in our prep questions, but I'm going to put you on the spot here. Coming out of this 2-year learning experience, you all already had such an incredible infrastructure of support built in Alamo colleges. It's really impressive. For those of you who don't know all of the work that they've been doing through their student advocacy network, it's pretty incredible. But sort of what's different, or what has changed, or what has been improved as you come out of this 2-year grant that wasn't there 2 years ago when y'all first started?
So one of the things, again, we benefited so much, from the grant and the funding and the research. But I think for across, the colleges, to have the data that we were able to also compare at a national level, to share that information with our leadership, our vice presidents for student success, our deans of student success, and through faculty orientation. And that was really rich. But we also identified the need for training, right? Because again, we didn't want to do this work alone, and we wanted to involve everyone across the college. So successfully, over the 2 years, we were able to train about 1,300 faculty and staff on mental health and suicide prevention. And that was, again, through the guidance of our technical assistants. And that is really, really important. And we were able to expand services to students that were not seeking our services. We were able to market and do outreach to them. Student parents as a large population of our Alamo students, 27% of our student population are fully online students, was another group that we were able to receive services for. And the grant really provided us with rich data and information so that we could really build and expand our services. And as a result, we had 25% increase in our students seeking services, but we had 82% increase in our students and their actual counseling sessions. So not only more students were coming, but more students were receiving services. So we were really, again, a great learning opportunity.
Amazing. That's incredible. That's work at scale, right?
Yes.
Okay. So we're a little bit past the half-hour mark. So I want to sort of move into sort of where we go from here, right? So as we think about this next phase of this partnership and this work, how are each of y'all, and we'll start with Leilani, how are each of you all thinking about sort of how we build and how we continue this momentum and how we continue to scale in a place the size of Texas?
I'm going to take the mic and then hand it to Dr. Duncan Brosnan first, because I really loved hearing where you are now, and I'm just so compelled to hear where you're going.
Thank you, Leilani. So we, again, because of the grant and because of the work of Meadows and Jed, who supported us with our strategic plans, we were able to create a formal proposal, and we submitted that to our Alamo board. And we were able to get funded 5 social work case managers in the work, of course, of basic needs. And then we were able to actually also get funded 2 additional personal counselors to reduce our counselor to student ratio. And that is amazing. Getting our teams fully staffed to be able to bridge the gap between basic needs and mental health, to also work with community partners, right? And how all of this work is couched in health, right? In our mental health, but also in our health, our holistic health perspective, and our basic needs. All of our mental health counseling is actually housed in our advocacy centers. And in those advocacy centers, our case managers are able to work with students and identify their needs, right? So we have homeless students, our foster care students. We also have students who, we have clothes closets, we have food pantries. We're able to support with utilities and daycare referrals. And so we were very, very excited when we were getting all of these positions funded. And currently now this spring semester, all the positions have been filled. And now we have the new staff being trained to expand our help and services to our students.
Not an easy feat when we know what a challenge workforce is. That's incredible.
Yes.
Leilani, you up next?
Now I will metaphorically take the mic back and go ahead. I love the case management approach that Alamo Colleges takes. I think it is so smart having, if the services are not co-located, at least the case management is, where someone is coming in for housing insecurity. They may also have food insecurity or mental health concerns, and they can get it all in one place. And as I mentioned earlier, we kind of have this deep relationship with each of the grantees from these check-in calls, where we really try to have talks about what's working, what's not working, and what should be elevated in the field. And through all of that, we recognized that there aren't a lot of frameworks in the post-secondary space that are really practitioner-focused, implementation-focused, adaptable to different communities, and comprehensive. So as we started looking at what's next for the Meadows Institute, we thought, well, we have a lot of this. We have a lot of the pieces. Why don't we design one? And we pulled together a framework that we call the Minding College Minds Post-Secondary Mental Health Framework. I dropped that in the chat, which is really undergirding the next phase of this work. And that is going to guide what is our larger Minding College Minds initiative, which is a multi-year, multi-funder initiative launching with investments from Trellis Foundation, Greater Texas Foundation, and Texas Pioneer Foundation, that is really going to kind of get Texas to a next level of post-secondary mental health. So this is kicking off with a partnership with Texas Success Center at the Texas Association of Community Colleges. I'm trying not to use acronyms, even though everyone working in education knows that we're all about acronyms. And TAC, that association is really the convener of community colleges here in Texas. They are at the forefront of strategies to improve student pathways, student persistence, retention. And they saw the same thing that we saw, that if we do not address mental health and well-being of our students, faculty, and staff, we are not going to keep moving the needle to the degree that we need to. So they really integrated the Mining College Minds framework into their broader Texas Strong Talent Pathways. And that is where we're going to start going as we launch the next phase. And we're going to work over time with all community colleges in Texas through a learning community model that we hope to replicate time after time to really get this high touch implementation focused work, implementation focused framework in front of each of them with a really big push on sustainability and the resources you have in your regions. So we're excited to scale all of this up to not a framework, we already have a framework, but for a model for post-secondary mental health in Texas and increasingly nationwide that works across different contexts like rural, urban, one campus, multi-campus, and then do some of the policy recommendations and financing work that really undergirds that success. So we're excited. And Jen, I know that you're a big partner in this. Did I miss anything?
I think the only thing I would add, that was, I think, a great summary, and hopefully everybody can take a look at the framework. But I think what really emerged in this partnership with the Charles Foundation with these 10 institutions was, you remember I mentioned at the beginning of the conversation, we're thinking about this work at scale, and we're thinking about what those best practices are at each tier that really are proven to make a difference in supporting student and staff mental well-being. And so this framework is based on a public health framework. It's the same way we think about how we provide really good healthcare, which is we have universal supports for all students. And then we work sort of up that tiered level to include, more targeted supports for students that have more needs, and then to really focus, specific focus on students in crisis, students and staff in crisis. And so when the Trellis Foundation hosted their big policy summit a couple of weeks ago in Austin, and we had the commissioner from the Texas Higher Education Coordinating Board. We had a gentleman come all the way from DC who works for SAMHSA. And what the theme was over and over was, if we're going to work at scale across an entire, institution or series of institutions, when you're thinking about a place like Alamo Colleges with multiple campuses, you really do have to be thinking about this at each of those tiers. Because if we do really, really good universal supports, our hope and prayer is that we won't have as many students and staff at that crisis point. And so it really is sort of a different, much more holistic way of thinking about not just one program, but how do we really think about this work at scale across an institution. Dr. Duncan Brosnan, is there anything you want to add to that, sort of given that you're sort of living it right now in real time?
Definitely. I think with the work, it's definitely from that perspective is having that strategic plan and working with the assessments, but guiding the work in research, right? That it's housed in research and best practices. And I think that for the sake of buy-in from all of our practitioners, our faculty, and our staff, it's important that, quite like Meadows did, is to create a curriculum that allow for learning, right? For our practitioners to learn, for our practitioners to be aware of the relevant data and the research and the best practices, because then they were willing to say, we have peer communities, active minds, and so we have 3 chapters starting, as a result that we know that this work is relevant to students, that we have students that are peers that are voicing, the need. When we look at how students are referred to our services, and we did our survey data, we saw that most students were referred peer to peer. So again, that's work that guides what we're doing, is that we notice that more students are coming because of our peers. Perfect example, we have our student parent support group, and at one of our colleges, and they're growing at the other colleges. But when we asked the students, wow, how did you learn about the support group? And they said, well, the student was in my class and she said, you should join. And they went from 8 students to 51 students. And again, it's, working with our students, listening to their voices, listening to our faculty, listening to our staff, Jed was able to provide a focus group of our practitioners, and we learned a lot from that also.
Wonderful. Thank you. Okay, so Jenny, from the grant maker perspective, what we've gone through this 2-year learning community. You all have been incredible partners in investing in this sort of new phase of minding college minds. What, as a foundation, how are you thinking about this issue? How are you thinking about how you can build on the amazing investments you've made and all of the different levers you're pulling as a grant maker from a systems change level? What are y'all thinking about? What are you talking about in your boardroom?
Yeah, thank you for that. And also, I mean, top thing is supporting the next phase of y'all's work. So we're definitely excited to be able to moving on to thinking a little bit broader and not the individual institutions, just the individual institutions. I want to share with my colleagues on the call a couple things that looking back, I would say, and then also looking forward. So I do want to say, especially if you're new to this space and if you're working with a campus that's new to this space, I do want to call out that it can be difficult to figure out sometimes exactly what to implement. And I am going to look to, especially Jen and Leilani, correct me if you disagree at any point, but there's some really strong research. But when we're talking especially about the universal supports on a college campus and what that looks like, a lot of this is uncharted territory. And so we're learning, right? We're experimenting, we're trying things out. And where we do have research, sometimes it's very contextual to your campus. So I do just want to say, don't be afraid as grant makers to be, again, I'm going to underscore flexible, because especially with those universal supports, it's really important for a campus to be able to think about it in terms of iterating, right? So we have this thing and we're going to try it, and then we're going to think of how we would double check and make sure it's working for our population and our students, and pivot if it's not, and then try again if, and just build on it. So I do want to underscore the fact that there's still lots of space for iteration and learning, and that I think we talk about that a lot, and it's important to bring into this context as well, that there are things that we know, but then there's things we still don't know. And so give your campuses the ability to double check and make sure. And I'm going to throw out a little example that I was recently talking with a colleague. So we talk a lot about syllabus references, and there's a lot of work that's been there, and knowing and including on a syllabus where a student can go can be really helpful. When you start talking about referring a student to a faculty member and telling them the faculty member will support them, that only works if the faculty member will, right? So it's very contextual to your campus, because if a student goes to faculty member because the syllabus says they should, but on your campus, your faculty members don't know what to do with that, you can actually end up in a worse place than you started out. So just knowing your capacity and just what looks good on your works well for your campus. So funders, be flexible with budget, line items where you can, and also on your timelines. I do just want to underscore that we, as funders, we know that often, a lot of times I mentally add 3 to 6 months to every grant project that comes in anyway. But especially in this space, and making sure that your grantees understand that that's okay. We try really hard to message that, and still had to have many follow-up conversations with folks to say, no, it's actually okay, right? Like, we understand you don't control the professional pipeline in your community, right? Like, that's okay. Let's talk about changing the timeline, and don't just do things to fill in the grant period just to do it. Like, we can pause and wait, like there's flexibility. So as much as you can, please think about that. And I do want to mention that that's something we're thinking about long term. Is, again, it's a professional pipeline for your community, not just your campus. And so as funders and as community members, being in conversation with the other parts of our communities, right? With the mental health professional community, and with our education partners from an education of mental health professionals. Like, there's a lot of complexities here, and a lot of this is a long-term play that we have to start planning now in order to build up an infrastructure for the future. So just reminding us of that. And then my final thing is just a little bit of context. So just to make sure folks are clear, so Texas doesn't have one system, right? We don't have SUNY and CUNY for our 4 years and 2 years. We don't have, so everything is sort of on its own. We have multiple 4-year systems, and then our community colleges, we have 50 different 50 community college districts. And so Dr. Duncan Brosnan is at the Alamo Colleges, so in our San Antonio area. She's talking about the campuses and the district in her very large urban area, but it's just one very large urban area. And then the group that Lonnie was talking about is the voluntary member association that all those colleges come to together for any kind of coordination. And we're just so lucky that center has been voluntarily established by the colleges to then serve as a TA, a coordinated TA and conversation point, and that they're able to move mental health into that. But for your states, if you're in other states, which I hope many of you are actually, that for this, it may just be like mentally translate to the community college system or, into your infrastructure, but really thinking about what kind of centralized conversation points, strategy points, or technical assistance points do you have in your state that you can then bring this conversation to? That's what I've got.
Great. Awesome. Okay. Well, Andrea has submitted a question in the chat specifically around how colleges and universities are approaching supports for faculty, staff, and administrators to model positive mental health access and help seeking. Would one of y'all like to talk about some examples of how that's working? And then Robin had a question about just examples of universal support. So it's a similar question.
So I can set us up with staging around universal supports. So the way that we approach it is really this intersection of promotion and prevention strategies. So whenever I'm thinking about promotion, and it's really creating a culture of care on your campus. So I know that Dr. Duncan Brosnan talked a lot about training, because I know that in your work, you recognize that faculty are often one of the first people who recognize that a student may be in distress. But if they are not equipped with the knowledge on how to recognize that, how to engage if a student comes to them with a problem, how to connect them with services, then we're really creating a stressor and not giving them the tools that they need to really promote this on campus. So I really do believe that training is a really important intervention under this universal strategies. And then I know that Dr. Duncan Brosnan, you mentioned something else and it's slipping my mind. I'm gonna let you jump in while I try to remember it.
We, and that's one thing that we saw, with the training with our faculty and our staff, and our peers, that you start to expand your network of support. And again, for our faculty, many of them would walk over students, for services by providing the mental health first aid, training to provide the assist, or the JED, suicide prevention training. That is all helps them to equip them to feel confident about providing services and referring students. But for our faculty and staff, we also have our human resources that provides resources. And recently, we did a joint presentation. Our AVC, Becerra, and our HR director did a wonderful co-presentation of what mental health supports we're providing for students and what we are providing for our faculty and our staff. And we saw the intersection. And that was really wonderful that we shared that with all our students, with all our faculty, with all our staff, and our practitioners and our partners. And so it was wonderful for them to all be aware of all the resources. And it was very obvious that many did not know about the resources that were available. Something very simple, but, just being able to also have an app for our faculty and staff, that they were able to, depression, anxiety, calming, to have meditation. I use it myself, come into the office, going through that rush hour and being able to use those resources. But again, I think how we can work together to provide, these resources and trainings for our faculty and staff to really be part of our partnership.
I love that. And that HR piece is a really big component, because a lot of these conversations are very student focused, because I know a lot of what we do in post-secondary is trying to get those students to and through. But we can't do that if we don't have faculty and staff that are being supported in the way they need to be. And for example, in my position at the Meadows Institute, I feel like I'm able to thrive because we've created a culture of care in the workplace. So as we're talking about this, thinking about how we support our faculty and staff, not only by offering them these supports, but enabling and empowering them to use them. So it's really thinking about that culture, because I remember a conversation I had with a faculty member recently where they mentioned we're really really empowered to like go on walks, but we're really not empowered because they're actually disempowered. They tell us to go on walks, but then when we do that and we're not in our office, then we get in trouble. So we don't actually go on walks because it's not something that we should do culturally, even though on paper they really recommend that we do this for our mental health. So really looking at that, I think, which is a workforce situation.
And then I know it sounds like an oversimplification, but this is something that came up at the summit a couple of weeks ago too on many of the panels, which is stigma. I mean, we talk a lot about mental health at the Meadows Institute, as I'm sure Dr. Duncan Brosnan does in her role at Alamo Colleges, because it's what we do, it's our work, but it's still there. And so, the more that we can break down that stigma, and it really does start with the folks on the front line, which are faculty and staff. And so that it seems like an obvious one, but it's something that we call out a lot because it really is still very much a challenge in many communities across Texas and probably the nation. Okay, I'm keeping a careful eye on time. We're at 1:56 according to my clock. So I want to make sure, could we do, Jenny, you were going to do the closing slides on announcements. If that doesn't take more than a minute or so, is there any chance we could do just like in 1 minute, each of y'all close with just a final thought? Leilani, you want to go first?
Sure, just throw me that curveball, I'm ready. My final thought is always the same in all of these conversations, and it is institution focused. So I'm going to say it to institutions who might be listening, but I want everyone to know that this is very hard. There is no right answer, and sometimes we might throw spaghetti at the wall, like I mentioned earlier, and it won't stick. But as long as we keep trying, we are going to be serving our students, faculty, and staff, and there are supports there. So I know if we get discouraged, having funders like the Trellis Foundation who are really committed to this mission, having partners like Dr. Duncan Brosnan who have been innovating and really elevating in the field of what's working, that is a game changer, and it really speaks to that commitment.
And I have to say that having such a wonderful curriculum and guidance, and Leilani herself was always available. She became part of our network. She became part of our family, and we looked forward to the convenings because they were part of reunions. And so at times, while things and work can be discouraging because we want to do so much for our students, we were always inspired by the passion of the work and the Trellis support, and again, recognizing all our team. And we learned so much from our partners in the other colleges. And again, we came with a learning heart and a caring heart. And again, we were able to accomplish a lot in 2 years.
Thank you. And I am going to do, I know as a webinar attendee and as a funder, there's so much, and there's only so much we can do in 60 minutes. And then there's so many questions that are in your heads and that we haven't been able to answer, and so many desires for concrete, even more examples, right, in a conversation. So I'm going to do a shameless plug for all kinds of additional information. So I'm going to share one. We have on our website a ton of different resources that Meadows and our team have built out as a result of this conversation. Meadows also shared their website. There's a lot of really great, deep resources that we'll be sharing with you, but also like reach out to us, because I mean, I am happy to have a conversation. If you're looking to do this as a foundation or as a state partner, happy to share more nuanced in response to the questions you have. I know that the folks on this call, we're all really, really invested in this work and would love to share with you. So please reach out to us, and please check out all of those resources. We have so many different ones we'd love to share with you. And then I know that there's slides I need to share, final announcements with y'all. So again, thank you so much for joining us today. We do have a video that will be available in about a week that'll be on the EdFunders site. And you can also sign up for updates, so please feel free to access those codes. We'll also be making sure that they include supports, all these resources that we're talking about. We'll make sure those links are shared with y'all. And then want to put in a plug for the next in this series again, thank you on behalf of the Postsecondary Access and Attainment Impact Group at EdFunders, and on behalf of EdFunders, thank you for joining us today. And we really hope that you'll join us in that next one that was on the slide, in addition to all of these other great upcoming programming that Adventures has for you. So thank you so much for joining us, and we look forward to engaging with you on these other topics and on this topic in the very near future. Thanks.